While testing a patient's color vision is almost certainly a part of standard neuro-ophthalmology assessments, testing a patient's contrast vision is not necessarily so. There are some neuro-ophthalmologists who incorporate it into their regular examination, and others who will use it as an alternative when testing of the color vision is problematic, such as in examples that I've alluded to in the lecture on color vision. So what are we talking about when we say contrast vision? So in the center of this slide we have a large A, and I would imagine that any of the viewers are able to see that A there. How about now? So probably you can still see it, but as you noticed, I've changed the contrast now. The background is still white, but the A itself is much less dark, making it perhaps a little more difficult to see, and probably you can see this still on your monitor, but maybe if you were on the other side of the room and the monitor settings were a little bit off, it might be a little bit of a challenge to see this A. What about now? This certainly can already be a challenge for some segments of the population, even the normal population, to see under certain circumstances, because we really are minimizing the difference between the target and the background. And so this is the idea of testing contrast vision. The problem is that when we test someone's vision in the clinic, we're testing it with a very black target letter on a white background, and that's maximal contrast. And that's really not what most people walking around encounter when they're trying to read and look at most things. We don't have this level of contrast. And that's why, again, a lot of patients who have an optic neuropathy will fall into the frustration of being told by the ophthalmologist that their vision's fine, it's 6/6, when the patient says that things don't look normal to me and I'm having difficulty functioning in certain circumstances. And this is because the ophthalmologist has not been attentive many times to testing contrast vision. So here's an example of a popular chart, the Pele-Robson chart. It can be used to test a patient's vision in the clinic. What we have here is large letters, all of the same size, but as you can see, the contrast progressively decreases to a point where probably most of us would have difficulty making out the targets here at the bottom. And we have the patient read off the charts and find where they're having difficulty reading, and this becomes the measure of their contrast vision. And this is just one possible alternative out there. So we've now spoken about that the evaluation for an optic neuropathy not only involves checking for the patient's central visual acuity, but also assessing peripheral vision with special attention to the pattern of the peripheral visual loss, assessing color vision and contrast vision. What's important to point out is that all of these are relatively subjective tests that rely on what the patient is telling us in terms of what they see, and this can be problematic under certain circumstances. For example, if someone wants to claim that they have a problem that's not really there. The last method that we're going to speak about that can be used to assess vision and the function of the second cranial nerve in a much more objective way is looking for relative afferent pupillary defect, and that will be the topic of the next discussion.